Yes. Hello, everybody. We're going to start our second session here. Uh, we have 4 presentations. The full panel is here. Um, so, David Rosnick from CEPR could not come, but so will act as the moderator, which yeah, I was going to say it's sort of funny because I'm not a moderate, so being a moderator is sort of somewhat incongruent. But so what we're gonna, this has a sort of a generic title. It's called Cross-Cutting Policy Issues. We're gonna have 4 presentations. They're not written. Again, I had to switch things, and I noticed that by switching things, I just place things in places. So it's not that I do not the alphabetical order, is that I was doing this in a rush. So if we go by alphabetical order, unless you have some reason to prefer to present in a different order, we'll go first Shaunna Barnhart from Bucknell. Then we're gonna have our friend Karim Nchare. I'm probably, hopefully not mangling your name, from Vanderbilt University. Then we're gonna have Débora Nunes from Monmouth University. And we'll end with Paul Zarembka from SUNY Buffalo, okay? So I'm gonna put the first presentation up. Shaunna, if you come and...
All right, so thank you very much. I'm Shaunna Barnhart. I work here at Bucknell University over in the Center for Sustainability and the Environment as the Place Studies Program Director. And today I'll be talking about scaling down of climate action policy, focusing specifically on 3 communities that we have worked with to talk about local climate action. So to start off with, the state of Pennsylvania does have a climate action policy. So I just want to go over that briefly and how that translates into these local plans. So the Pennsylvania statewide climate action plan has emission reduction targets for 26% reduction by 2025 and 80% reduction by 2050, with 2005 being used as the baseline. Recent numbers I saw had us at about a 23% reduction. So we'll see where that all shakes out when they finish the most updated emissions. The reduction strategies that are in that plan are the standard ones that you would expect in climate action initiatives. So focusing on energy and transportation, buildings, agriculture. But the state recognized that having a statewide plan does not necessarily equate to things that are going to impact or improve quality of life around the state if it's all from a state level perspective. And so they started a program through the Department of Environmental Protection to do local climate action planning. And so this launched in 2019 from that department, DEP, that partners local governments with universities and ICLEI to create local climate action plans. ICLEI and the universities provide the technical support with local governments to go through the process of creating greenhouse gases and creating these plans. ICLEI has proprietary software for greenhouse gas inventories. Since it was launched in 2019, 80 local communities have been involved in this project, with 19 universities being involved as partners with them. In 2022, the state changed the program, and rather than being administered by the state, it is now a partnership with Penn State University, and Penn State has been partnering with the majority of those local governments since that time. And so if we think about climate action plans and thinking about kind of critiques of them, like what are these things, do they actually have an impact? Who are they being done by and for what purpose? And so I've just collected here for some talking points with some of the common critiques, first one being climate math. So when you start a climate action plan according to the procedures that are commonly used and in place with ICLEI that's providing the technical support, you start with a greenhouse gas inventory. By doing so, that's a very technocratic approach to policy in terms that you're using this greenhouse gas inventory to inform bureaucratic decision making. A lot of those greenhouse inventories are based on best estimates, not necessarily measured data, as we've run into with these various plans we've been working with here locally. So one of the problems with climate math is that it can alienate and exclude. And so if you start a conversation by saying these are the numbers, then folks might kind of opt out of the process and feel as though since they're not a technical expert, they're not really part of helping to determine solutions. It can become an exclusionary process, and then it can also limit creative solutions as well as not shine a light on the things that actually matter to communities in terms of trying to address systemic injustices that climate change might exacerbate. Plans may not be strong drivers of change. Maybe you put this plan together and the stuff that's in it would have happened anyways. Maybe the things that are in it don't happen because there's really no consequence for local elected leaders if they are unable to realize these plans. And so an article by Millard Ball really looks at whether or not climate action plans lead to change. Are they the driver? Are they the cause of change? And looking at this through two different types. And so conformance would be that you've created a plan, you stick to the plan is your checklist, and you do the things in the plan. Things in the plan would not have occurred otherwise, right? And then the performance approach would be that you have created a plan and the value is in the planning process. Because you went through the planning process, you made new connections, you made new partnerships, new action has been inspired that may or may not be in the plan. So yes, you got a checklist in the plan, but you'll be doing things, but it inspires other action outside of the plan as well that would not have occurred otherwise. And then, in response to all of this is the argument for just transitions. So the idea here is about focusing on co-creating regenerative economies that are not just extractive. So planning processes can be very exclusionary in determining based on how they might be set up, and they may not go deep enough to address underlying issues of inequalities or systems of exploitation and exclusion. And so the argument with the just transition is that by co-creating the futures that we want, you have a more inclusion, a process that has more inclusion and can really address the underlying issues. All right, so with that as our context, I'm going to talk about three different case studies with three communities that we have worked with through the Place Studies program as part of this state program for local climate action plans through DEP to create these documents that help to pull together some climate action priorities. So we have Shamokin was the first one that we worked on, and then we worked with Lewisburg Borough, and we're currently working with Coltmont Borough. That one is still in process. Shamokin and Coltmont are both in the neighboring lower anthracite coal region. So if we take a look at this map, you see where Lewisburg is, and then Shamokin is in the southeast corner of the county, and where the N is in Shamokin is approximately Coltmont, right? Just to give you some spatial reference there. And so we have been working in the coal region through the program under an initiative called the Coal Region Field Station for the past 10 years. And so these two plans in that region build on that whole body of work and collaboration over that time. And so the map that is underlying this is a screenshot from the state of Pennsylvania's environmental justice mapping tool. So you'll hear more about that this afternoon with that particular tool. But what this is showing is the darker the blue, the more environmental justice concern there is. This map takes into consideration 32 different factors to classify areas as environmental justice. And so the one over here, that is Shamokin, and the one over here is Coltmont. And so you can see Coltmont is surrounded by environmental justice areas, but due to various factors, it doesn't rise to the level of being classified as environmental justice, even though it's right smack in the center of all the coal fields there. So some quick comparisons here across these three towns. The things I want to draw attention to here are the ecological considerations and then the poverty rates here. And so again, Shamokin and Coltmont are in the lower anthracite coal region, and so there are challenges with legacy pollution from the coal mining industry, with Shamokin also being home to the largest coal bank in the United States. Lewisburg, ecological considerations here are quite different. It's more focused around the river, right, and concerns with flooding. If you take a look at the poverty rates here, the average poverty rate for the state of Pennsylvania is about 12% for the state, and so you can kind of see how these compare to that state average. Shamokin has one of the highest, if not the highest, poverty rate in the state. Recent studies have put it at actually higher than 30%, and I tried to go into the census to get the most up-to-date numbers, but those websites aren't working currently. So we'll have to wait. um, so it does have one of the highest poverty rates, if not the highest, in the state. Lewisburg falls in the middle range there, higher than state average, and Coltmont comes in with the lowest poverty rate. And so this just provides some of that social context of thinking about what impact these plans might have. So this just gives you a quick glance at just some timeline information here. What I really want to draw attention to is the distinct actions and the planning approaches in comparing these. And so the Shamokin plan was very kind of streamlined, focused on some high-level things. What they wanted to focus on there were things that could be considered easy early wins so that they could build more support around environmental issues and climate change, although they call it environmental resiliency plan. So that then they could inspire more action and eventually like a more in-depth plan. With Lewisburg, it was much more detailed in terms of the action items there. They got a list of 54 different very detailed action items, and Coltmont's is still in progress. Now the planning approaches in all of these were different. So in Shamokin, we had a steering committee, and this was during COVID, which really impeded the planning process. So that was with a smaller steering committee, and individuals from that committee then would go out to the various groups that they were connected with to gather information and build coalitions. In Lewisburg, we had a task force, a 19-member task force, and we worked to make sure that that was kind of representative of a bunch of different nonprofits and civil society sectors. When we first put it together, we looked at our list and said, oh my gosh, all of these people are like 45 and older. We have got to figure out if this approach doesn't work, you know, because all of these people aren't going to be here by the time this thing is supposed to be finally implemented, right? And so we worked then to get age diversity represented in that task force. And in Coltmont, we went with a series of town halls. We did 5 town halls. Anybody could show up and share their perspectives on these elements for the plan. So in Shamokin, a lot of the key areas for action centered around lowering costs, right? It's about how do you lower energy costs? That is the framework to enter into this. So with weatherization, renewable energies, thinking about ways to lower costs is really what drove a lot of this, as well as their drive for revitalization. So it was this combination of lowering cost and trying to choose things that would support revitalization in the city. And it's worth noting that this is just one of many plans in Shamokin. Within like a 3-year period, 4 different plans for the city were generated with different focal points. If you take a look at what has happened in the city as a result of this, so we've got, there's a lot of action that has happened, but it's kind of falling under that like performance umbrella. Right? So some of the things in the plan have happened and are being worked on, but a lot of other stuff happened because of the planning process and because of trying to implement this and building that broader base. And so there are capacity issues across all of these. In Shamokin, it was an Act 47 city, which basically means it was bankrupt. And so what we did is we hired AmeriCorps Vistas to support us in building capacity in the city of Shamokin to implement this plan and associated actions. And we were fortunate to have an AmeriCorps Vista for 2 years, but that came to an abrupt halt at the end of April when the AmeriCorps system was shut down. But it was a very good 2-year run that we had with that. Okay, so for Lewisburg, if you take a look at these areas of action, it's really focusing around the, we're focusing around here like the ecosystem concerns, biodiversity, right? We're thinking about shade trees as part of all of this. And you see other things in there that are pretty standard across typical climate action plans with thinking about transportation, energy, things of that nature. This is a very incomplete list, but I just put this up to show like some of the things on this list are there because there was talked about in the meetings and came up in the plan. Other things have been going on for years. And so these plans can also be used as a way to put a bunch of related activity that's already happening under one umbrella to give it all a coherence rather than being individual projects, right? And that is very much what happened with the Lewisburg plan and is also happening with the Coltmont plan. So over in Coltmont, the plan's not done, so it doesn't have an official name yet, but it focuses on energy, transportation, waste, and resiliency. And so this is just the timeline of where we are so far. So we did a greenhouse gas inventory in the fall. And with Coltmont, we started with a community survey. In Lewisburg, we did a community survey at the end to see if the things that the task force came up with resonated with the public and other ideas the public might have. In Coltmont, we flipped it. And so in Coltmont, we did the survey first. It was open for 3 months. We had like 85-ish responses or so. And then we used that analysis to design the town halls to help inform discussions. And then we had a series of 5 town halls, 2 weeks apart, and we're still working through finalizing what that all means for action items. And so this is just a photo there of one of the town halls, and that all those post-it notes is the aftermath of a town hall. So that's just after the first one, and so all of these post-its end up back in my office, and me and the student team start to assess those, not assess, we start to categorize them and come up with the common themes that are coming out of all of those ideas. And so it's still, as I said, it's still a plan in development, but you see some of the common things. There's going to be things with energy transitions, reducing energy costs. One of the things that came out of the town hall discussions that did not come out as strongly in the other 2 is this idea of improving community connection, particularly with the elderly and the isolated. So no matter what the topic was, there was always people there who were saying, well, okay, if we're going to do weatherization, how are you going to make sure that the elderly and the isolated know about these programs and can benefit from them? If we wanted to be able to respond to heat and we have a cooling center, how are we going to make sure that the elderly and the isolated and those without air conditioners, are in the know about what's happening and where to go? And what if they have mobility issues? How are we going to get them there, right? And so those things all came up through that community conversation in a way that the task force approach was not capturing. And so Coltmont has been doing quite a bit of those individual projects, and they want to wrap it all underneath an umbrella of this plan. So they've already been pursuing a 2-acre solar array, an active transportation plan, improving the recycling options. They've already worked on stormwater management. And so I'm going to compare some of these examples here. So both Coltmont and Shamokin received a MORE grant from the state of Pennsylvania, which pays for energy audits of public buildings. Shamokin were able to get theirs because we had the AmeriCorps Vista that applied for it and then managed the program when it was awarded. And so you see him, that's Matt McMullen there, on the front page of the newspaper with the energy auditors there. And so the city then was able to actually get a new HVAC system for one of the largest public buildings in the city. As a result of that. There's a lot of interest in solar as well. And so this is a project in Coltmont that's going to have solar panels on that building so it can be off-grid. There's also going to have a gray water system for toilet flushing and things like that, so it'll be a completely off-grid building. This is the community pool in Shamokin where our AmeriCorps Vista worked with the city to work with students here on campus to do an assessment of whether or not they could have solar as a viable option to offset the cost of the community pool because it's a really valued resource. And so that's kind of all on hold now, but again, interest in that. And then in Coltmont, they're working on this 2-acre array. The idea with this in Coltmont would be that if this were to come to fruition, it would completely offset the $50,000 light bill that they currently have for their energy use, plus generate additional revenue. So they're looking at potentially $200,000 that would be revenue to the borough so that they can use that for community priorities and not have to take it from taxes. And so just to wrap up here, some of the challenges, capacity, right? Capacity with time, capacity with money. And so local governments are dependent on grant funding to make a lot of this stuff happen. And it requires partners to implement as well, because you come up with all kinds of great ideas on paper, but local government does not have the staff or capacity to be able to implement it. So it really needs that broad-based support. Support can change, right? We saw that with the changes in the federal government level and Shamokin losing their AmeriCorps Vista. It could change here at the university. It could change in the communities. In Shamokin, we're on our 3rd mayor now since we started this, right? And so, there's thinking about how to build like a resilient system so that even as people and support changes, that everything can keep moving forward. In partnering with the university, there's always the challenges of conforming to an academic calendar. Overall awareness and engagement with the process and implementation. So again, I think that the Coltmont one was more inclusive in terms of like anybody could show up to those meetings, and we were actually seeing things that we weren't seeing in the other towns as a result of that. And students get to learn from community leaders, and they have a better understanding of how local change can happen. And then I just want to thank everybody that's been involved with this over the years, and so the local government partners, the task force members, the nonprofits that step in to lead the change on these various actions, the members of the public who came to the town halls, did the surveys, and are putting their time and energy into realizing the futures that they want for their own communities. And then to the 7 place studies scholars, the 2 AmeriCorps Vistas, and the various classes that have partnered with all of those. Yeah, I could say a whole lot more about this, but I'll just wrap it up there. So.
Morning, everyone. It's really a pleasure to be here. Thank you, Matthias, for putting together with the team this conference, and thank you for inviting me. So this is a joint work with a colleague of mine, a statistician at the African School of Economics, Nchare. The motivations of this work stem from the fact that obviously there has been signs of rising income inequality, which is only just putting more pressure on the wealth concentration that is observed. So this is data from the World Income Inequality Database. And in this room, there's a lot of people who have written about what happened in the 80s, right? So that we can see this sharp increase. So, as I mentioned, my colleague is a statistician, and what he cares about is about developing statistical distribution to fit the data. So, in this literature about analyzing income inequality, so we all know the reason why, right? Why tackling the issue of inequality is important, right? About social unrest, eroding trust in institutions. When it comes to being able to model income distribution, traditionally they have been dominated by 2-parameter distribution, particularly the log normal distribution, right? But again and again, it has been shown that the log normal will fail to capture some of the key parameter in income distribution, which is typically characterized by a lot of skewness, a lot of asymmetry, and also heavy tail behavior. So what has happened, particularly in the literature from econophysics, is that in the recent years, there has been a lot of new parametric distribution that has been developed in order to fit the distribution of income. But what is lacking is that those distributions are really good at fitting the data, but there's no really much economic intuition about the behavior that is actually generating those distributions. So one family of such distribution is a distribution based on the concept of maximum entropy principle. So the entropy is a way to measure the average level of uncertainty in the system. So it has been used a lot in information theory, but also it has been applied recently a lot in the behavioral economic literature about rational inattention sub-literature. So those kind of distribution has been shown to match well the actual data, but still they lack economic interpretation. So what I'm doing on the next slide is to give you the kind of the structure of how those distributions are generated, and now we will go over a few examples, okay? So, a bit of notations, right? So first equation 1 is just a definition of what entropy, how entropy is measured. So here we are talking about the Shannon entropy measure, right? So the maximum entropy principle, what we will do, we will try to pick up F here is the density function of the variable X. So think about X here as income. So I will be trying to find the density of income by maximizing entropy under some structural constraint, right? So one of such constraints is that I observe the data, so I know what is the mean income, I know what is the variance, so I can impose that as my constraint in my maximization principle. So of course, there's a normalizing constraint, which is the 1 C0, right? The sum of a density will always be equal to 1, right? So all of that information is combined together. And what is nice with this kind of maximum entropy principle optimization is that we are dealing with a convex problem, right? The objective function is concave. You have linear constraint. So we know from our convexity that first and second order conditions are enough for us to solve the problem. So it's easily solvable by Lagrangian method, and this is typically the shape of what a maximum entropy distribution will look like. Okay, so what I do on the next slide is to tell you that actually a lot of distribution that I use to fit income data are actually generated from the maximum entropy principle, right? So we have the usual suspect, we have the Pareto distribution, which is typically imposing a constraint on the average of log income, right? We have the log normal, which is characterized by two parameters, a constraint on the log of income, the mean log and the variance. But as you see on the slide, there has been recently newly added distribution. And as we go down, the complexity of the constraints that are imposed on the data become more complicated, right? And the more we are able to fit the data, so if you use this distribution, you will perfectly match the data, less and less we are able to make sense of these constraints. They make sense in terms of mathematics, but in terms of economic intuition, we don't know what they mean. So that was the motivation behind starting this project with my friend. We're looking for, okay, can we come up with a framework that will allow us to still keep the principle of maximum entropy, but introducing some behavioral foundation regarding first, what are the action of economic agents and the complexity of their interactions. So in order to do that, after doing some research, we came into something called the Quantal response statistical equilibrium model. So I believe Özlem has some work on that, applying that to housing market, right? And then the idea is the following. So we will keep the notion of trying to maximize the entropy in a complex system, but we will allow for the modeling of agent economic action. So that's the first aspect. The second aspect is that this type of model are characterized by the notion of a negative feedback loop. So the idea is the following. In the context of income, so the way we are framing the model, we are assuming that we have a typical economic agent that will decide whether or not to enter into an income-generating activities. So by doing that, if there is a net influx of workers, for example, getting into the labor market, of course, they are getting into the labor market because they are expecting higher income. But by a larger influx of workers, it is pushing pressure on the competition, and then we have a negative impact on the salary. So how do you characterize that mathematically? So that's the first aspect. The second aspect is that we do observe income data, but in the survey, we never observe the decision of whether I decide to enter on the market or not. So we are dealing here with a kind of incomplete information model. And that's why, again, the concept of entropy is important, because by using the maximum entropy principle, we can be able to back out the unobserved action of the economic agent. So I have the entropy concept there, but then one first constraint we can impose is that on average, the signaling of entering the market is because I'm expecting a higher income. So people that are leaving the market on average are worse off in terms of expectation that people are trying to enter, right? So this is this constraint that is characterized here. So there's a market signal, and people will be deciding to get into, for example, the labor force because they are expecting higher. People will be leaving is that I'm better off just staying out. So this combination is what is combined to impose like an economic constraint on the maximum entropy. So what is again interesting is because the way the model is set up, due to the nature of the Shannon entropy, everything is convex, so you can apply the Lagrangian and solve for the system. So if you do that, you will be able to solve for what the distribution of income will look like conditional on the actions of the economic agent. So what is interesting is that my presentation is titled Income Stratification, but I have not mentioned yet the concept of heterogeneity, because all of what I'm presenting can be conditioned on the type of agent, right? We can analyze that conditional on gender, ethnicity, education, and then we can have different parameters based on what group of the population we are looking at, okay? So we have a distribution of income conditional on the action of the individual agent. Now we can go to the next step in order to try to model what is the shape of the distribution of agent conditional on signal from income. So that's the next step. That's when we are able to add a behavioral structure inside the model. So what we'll be doing, the first equation 7 is saying that the economic agent is maximizing its expected payoff, right? As you can see, of course, conditional on a constraint on the density, and we are allowing that there is a minimum of information in the system. That's the third constraint. So the technique is called Quantal response due to the shape of the distribution. Some of you are familiar with the logic model, right? You can see the structure here. So with this optimization, the equation 7, I will combine with our initial result here to have a sense of the general distribution of income accounting for the movement in and out of economic agent in the market. So it looks like it's a fancy formula, right? Then the idea is that now we do have economic interpretation for the parameters that are included inside the distribution, contrary to what is currently done in terms of statistical distribution. So in terms of interpreting, we have market signal, we have the average value of income, and we have a parameter T here that is interesting, which is just coming from the Lagrangian coefficient. And in this model, the Lagrangian will give us what is the importance of the information constraint on the behavior of the economic agent. Okay? So this is the general result. So what we are doing in our work in progress is that we have a more general version of this model where we allow for different type of behavior. And of course, if you allow for that, we need to add the fact that then the population is segmented. So we need to add more structure to that. So we do that. In terms of application, the data, we went back to the database on the World Income Inequality Database and focusing on Italy. So I will just quickly talk about the data and some of the stuff we are planning to do. So we use some data from Italy, right? At the start of this project, we wanted initially only to focus on wage income, but the way typically the income is compared at the global level, we aggregate all sorts of income. So in the database, the income is generated by 4 different categories. But one thing that is allowed in this model is that we can also split them into 2 groups, for example, to have the joint distributions. That's something we are planning to explore too. So we use this data and we compare the performance of the Quantal response model with the other distribution I showed you earlier, right? So this is one of the results that we obtain, right? You can see that the Quantal response model is perfectly blended in the shape of the distribution when compared to the other distribution. There's one that is not capturing the peak well, right? The the kappa generalized, which in some other data sets were able to match better the data. But again, we have a model that performs quite well, but also can give us an information regarding the behavioral nature of the economic agent in the market. So what we are thinking about for the next step in the project is to be able to use the parameter to do some kind of welfare simulation, just like Ashima did in the paper. We'll be able, using the SQS, this parameter, to simulate what will be the impact of a redistributive tax income policy on the shape of inequality. So that's the next step we are actually currently working on. And I will stop there. Thank you so much.
Hi, everyone. My name is Débora Nunes, go by Deb. This is a working project with my dear colleague Vinicius, who is also Brazilian, but who's not here. He's a professor at Denison. The working title is Short-Term Challenges of Long-Term Growth, Gendered Consequences of Infrastructure Projects in Brazil. I'm a professor at Monmouth University, which is just short of 4 hours drive from here, and I arrived at 1 in the morning. So I'm very tired, and I'm sorry that I wasn't here yesterday, but hopefully my brain will not betray me today. And I'm sorry that I was late as well for the morning presentations. They were wonderful. So I'm going to talk to you about my motivation and research question, the background of the literature, the case study that we are focusing on, and then the qualitative data, which is what we have so far. And then I'm going to talk to you about what we are trying to do, which is the quantitative part. And I'm super excited to hear your suggestions, questions, opinions on it, and then some possible policy implications of this research. So infrastructure building is a vital component of economic growth and development, and there are Levy folks in the room who are very, very big experts on that. So I'm going to focus on physical infrastructure, specifically on electricity and energy access, water and sanitation, transportation, and ICT, information and communication technology, and social infrastructure, which is education, healthcare, and social care services, because that's what most of the literature already supports. So I'm going to briefly show in the background what the literature talks about that. And there's a lot of literature that shows that those have unique impacts for women and girls, especially in terms of economic empowerment, so income, gender pay gaps, and labor force participation rate. And of course, in terms of time use, so how much time women spend on paid work versus unpaid work, and infrastructure has a lot to do with those outcomes. But there's not a lot of research on the impact of the actual building that infrastructure. Infrastructure requires gigantic projects of building a railroad, of building some roads, of a hospital, of a school. And so that's what we want to focus on, because that means they're going to have a significant influx of construction workers who are middle-aged men in very small communities. And so we're going to look at a case study of that to try to understand what could be the immediate local impact of these projects that we know they're so important. So our research question is, how does the temporary influx of construction workers during infrastructure projects affect the safety, education, and health outcomes of women and girls? So that's why we call it the short-term consequences, but we know that those tend to have long-term secondary consequences as well. And the hypothesis is, based on our case study, that there is a higher vulnerability of rural and impoverished communities to those temporary influx of workers. There are unequal gender distribution of jobs among the local labor force. And a lot of these communities, once they see this opportunity with all of these foreigners coming, a lot of those girls especially see that as an opportunity to escape a poverty trap, which is very dangerous. So that's what we're trying to do. What does the literature says? Again, we have experts in the room, so I'll try not to embarrass myself and I'll go kind of quick about this. The gendered impacts of physical infrastructure are very well documented in terms of electricity and energy. Some of my research actually focus on how much energy specifically impacts households in rural environments, picking up firewood, how you're gonna cook, how you're gonna maintain the food. All of those are women, stereotypically jobs that women and girls do. And so whenever you have access to electricity, there's a ton of literature that says that there's a concave relationship, so it's not even straight, it's exponential. And it shows improvements in life expectancy, school enrollment for girls, literacy, labor force participation rate for women, and employment. In terms of water and sanitation, a lot of the channel that relates better access to safe water and sanitation is mostly through health outcomes. Whenever people get sick, it's women that have to take care of them in the household. And picking up water or clean water in general is a task for girls and women. So I grew up in southern Brazil. I'm gonna show you a map in a minute. And we had the water that was in the house was good for like doing laundry, that type of stuff. But water to drink, you had to pick it up down the road because that was the safe water. And that's what kids do. The adults tell the kids to go there. So there's a decrease in time spent on unpaid domestic work when that infrastructure is built. In terms of ICT, that's where a lot of the research is focusing right now. In terms of communication access, bringing sense of independence, freedom, self-esteem, and access to resources. There's some really new interesting research that shows how that impacts ability to leave situations of violence, for example. So I think it's a new frontier. And then transportation, which is the example which we're gonna use in our case study. There's a lot of research that shows that the type of transportation matters, how safe it is for women to go from one place to another place. A lot of transportation is still very gender biased, so who has the car and who has the ability to drive a car in general are men. And so the impact of transportation is more of a sensitive issue because the quality really, really matters. And of course, the ability to access the social infrastructure is vital, and large traveling times for women because they have less access to cars or motorcycles also have an impact on time use. In terms of what we call social infrastructure, so education, healthcare, and social care, here the impacts are obvious and direct and very well researched. Most of the evidence that we have in literature show this very convincingly. So I think that education is likely the most well-documented one. And more access to education to everyone, right? When you have more access for children, for women, and for men in general, you see all of these impacts of lower fertility rates, an increase in the age of first marriage, lower rates of domestic violence, different outcomes of intra-household bargaining, with more educated men actually spending more unpaid time doing domestic work in the household. So there's a whole bunch of stuff in there. In terms of healthcare, there is evidence of reproductive, non-reproductive, and mental health care having significant impacts for women's well-being. And then social care, which is childcare, elderly care, care for disabled people. There's a whole bunch of evidence that shows that this impacts time use and gender pay gap and labor force participation rate. So I did this brief overview to be very, very clear that we're not saying that infrastructure projects are bad, okay? We know for a long time that they are good and they have good gendered outcomes for women in terms of inequality, empowerment, and a lot of desirable things from an egalitarian perspective. But we're looking at how local communities are impacted by that in the short term. And so a lot of that research showed that the type of infrastructure matters, first of all, and that how the infrastructure building is capable of impacting time use for women actually can have diverse impact on gender and growth. There's a really good, interesting model from Agenor and Agenor that shows that, and there's a whole bunch of other models also that model this relationship of public infrastructure can have different impacts on time use, that in turn can have different impact in productivity effect on home production, and effect on human capital. So a lot of the literature is focused on this, which is really important, but we're trying to look at a more disaggregate level, short-term household individuals, understanding that these channels are also there. So the immediate impacts are less explored, and in general, the contemporaneous impacts are less explored. It's almost like exposed effects of the building, not during the building what's going on. And the World Bank has assessment criteria of gender inclusion and gender impacts of infrastructure because, again, that literature is very well developed. But those are very general guidelines, and they talk about how much we need the presence of gender analysis in social and environmental assessments, but they're very vague. There's no specific points on how that can transform outcomes in terms of health, and that's what we try to bring to the table. That's the policy implication that we think that can arise from this study. So what's the study? We take this, let me see if I can click here. Yes, I can. Look at us. Okay. This is the great country of Brazil. This is the last great country of Argentina. No kidding. I'm from here, Rio Grande do Sul, but we are talking about a railroad that it's all the way here in the north part of Brazil, between the northeast and the north part of Brazil, which is the poorest area of the country. And so this railroad here connects this part, which is a mine, with this part, which is a port. Yeah. So there's the land of acai right there. Mm-hmm. Oh no, I don't know how to come back to where I was. No, what did I do? My screen, maybe? Here, found it. Yes. Beautiful, thank you. So this is the railroad, and it already existed, and this project was to duplicate the railroad because Vale S.A., which is this company, that it's a mining company, discovered the largest open pit iron ore mine in this place here, and so they need to duplicate the railroad to be able to take more of that mineral to the ports. So the mines belong to Vale, and the railroad also belongs to Vale. And the railroad is not only for the transportation of the minerals, but also for the transportation of people. But it's in a smaller scale. 96% of the total revenue of the railroad comes from the transportation of Vale's mineral itself. So it is a project that was already there. They were just expanding it. We are specifically looking at the impacts in this small little town called Tufilândia. So if we go back to the map here, hopefully I'll be able to get here again. Here, Açailândia, which is where you have açaí. Here we have Santa Inês, which is one of the places where they have a station for both passengers and minerals. And here you have Tufilândia, okay? So it's close by to Santa Inês, 12 kilometers more specifically, which is like 30 miles. Okay. And it's approximately 5,000 people that live there, which is very, very small for Brazilian parameters. Brazil tends to have larger municipalities. More than 1,000 of families there receive social benefits to be able to complement their income, and the poverty rate is around 52%. So it's marked by a lot of poverty. In 2014, there was this sudden influx of over 300 male workers employed in this road building project, and they were there for 3 years. They projected at least 200 direct jobs and at least 100 indirect jobs. And during that time, in 2015, this amazing journalist, Auri Rebelo, who generously shared all of the qualitative data with us, which is the data that we are using, went there to conduct interviews for a week and also talk to the people later on. And so what I'm going to talk to you about now is horrible, and it can be triggering for some folks. So if you need to leave or close your ears, I'm not going to bother. And I appreciate your patience if I break as a survivor myself. So in terms of the employment and training, so he named his series As Novinhas e os Visitadores, which in Portuguese means the young girls and the visiting men. And in terms of employment and training, those direct jobs, there were very few, and almost all of them were for men. And to get those jobs, it involved direct bargaining with work site managers that usually involved some exchange of favors. So bribery, child prostitution, sexual favors were a part of the deal for you to get a job, or for your husband to get a job, or for son to get a job. Indirect employment, like women that were trying to cook little to-go things for the work sites, all of that were also kind of in that same process of informal negotiation and bribery. And according to the official numbers, we had only 50 people that accessed formal training, and those are the professions which are very, very male-dominated. And here I have a line that says that 110 official positions were actually occupied during the period. This is an interview with one of the managers, and what he's saying is that people here are not qualified and they don't have any experience. The local workers just get whatever jobs are left because all of the jobs go to people from outside. And so here's some news talking about this violence that happened in August of 2015 because the locals were furious that they were not getting any of the jobs. So they threw rocks on the employees from Vale. They put a whole bunch of tires and furniture on fire on the streets to try to claim for jobs. So there were a lot of violence as a consequence of this lack of jobs that were promised. In terms of the conversations with girls, in general, this happened in WhatsApp, which is the app that most Brazilians use to communicate. We don't text, we WhatsApp. And they are generally between men in their late 20s or early 40s and young girls, maximum 16 years of age, minimum 12. In general, they are scheduling dates at Praia do Jacaré. If you notice the map that I showed you, there is a river that goes there. A lot of the bars and parties are along the river because they're far away from the houses, so you can have loud music and it can go until later hours. So you have high alcohol consumption, a party environment, and frequent sexual encounters that happen in the cars that are parked there. And a lot of the cars belong to Vale, the company. A lot of these men, to win some of those girls, offer gifts. So this quote talks about, when there's a girl here that we like, we tell them that we are exclusive so that only you can fuck them, pardon for the French. Then you give a gift, like some flip-flops or a phone or something different for them to eat, like a chocolate, and that's it. You have a lot of them talking among them about the lack of older women available for relationships. They have between 14, 15, up to 17 years of age. Here, there's no such thing as being underage, because girls that are 18 or 20, they are already fat or done or with kids. So we have to take advantage of them while they are young. There's no issue. No one here thinks that that's bad. Here, all of the young girls start early, get pregnant early, get old early. So by the time they're 25, you don't want them anymore. Now it's the time for them to be with us. In terms of the conversation among the girls in that community, they see this man as their ticket out. They have hopes for marriage, family, leaving to Finlandia. There's this specific girl that mentions how he said that he cannot marry me, that he already has a family, he already has a son, but he doesn't like women, he likes me. So she sees herself as a girl, but she believes in that love story of getting out of there. Unfortunately, there's a lot of cases and rumors of STIs. Everyone is very aware that condoms are not a thing in that community, is seen as something that you just don't do. because they're clean and healthy, and condoms are for unhealthy girls. And so they keep pointing to each other, telling that they have HIV or some other STIs. Here is what one girl was saying to another man, like, if I were you, I wouldn't go with those two girls. You don't even have to say hi to them, and they already opened their legs. With the amount of men that they've been, they certainly have AIDS. And all of them talk about the lack of quality local men, right? We want these men because they can get us out. Here we only have people that have no education, no qualification, alcohol abuse. There's nothing here for us. Tufilândia doesn't have any type of higher educational institutions. All they have is a high school, and that's it. And in terms of relationship with families, when he goes to interview the mothers, unfortunately, they also see that as a possibility for their daughters. They see it as a ticket out. They see it as something to improve their daughters' lives. The only thing is that in Brazil, we have Bolsa Família, which is a benefit from the government that complements your income. And as I mentioned, a fifth of the families in this place rely on it. And for you to receive the benefit, you have to keep attending school. So a lot of the times the bargaining is you have to go to school. You can do whatever you want, but you have to go to school because otherwise I cannot get my income at the end of the month. So that's the qualitative data that we have. So sorry for depressing everyone. And now in terms of quantitative data, how do we do this? How do we show, in a time of evidence-based policy, how do we show that we need to worry about this? That it's just not just a little story from a little place in the middle of nowhere, right? And so we've been taking a lot of the databases that we have, unfortunately, because it's a small city. The hospital is in Santa Inês, which is 20 kilometers away. The data is very sparse. HIV cases, there's just 0 or 2 in the years. We do see evidence of higher pregnancy rate among teenagers, but a lot of them lie about their address and where they're from when they get to the hospital because they don't want their families to discover. And so we are struggling with that. What we're doing is building a causal inference model. So for now, we tracked all the stages of the railroad building and, to see anticipation effects, when the workers actually arrive, when the first projects start to come there. But we were struggling with which variables are going to show us what we want to see. So currently we have gender pay gap and labor force participation rate. We have life expectancy at birth. We are trying to get creative to get data on substance abuse, addiction, and mental health, but we don't really know what else to look at to, show that this matters in terms of measuring. And so we think that this has potential to prevent policy blind spots, potential impact on infrastructure development and project designs. A lot of them are focused on adults and employment-related outcomes and time use outcomes, and we think it's important to look at girls and teenagers. And of course, that we have long-term consequences of this as well. So if a lot of those girls left by the age they were 14 and pregnant, if you look at that same location to see if the community got better off, you'd be losing them from your sample, right? So seeing that out migration and see if that actually happens would be important for us to see the further consequences of this project. And so we are trying to map that. And so sorry for depressing you, and thank you.
Okay, first of all, talking about complex world, I think this is really a complex topic. It's much more difficult than sort of meets the eye. Let me preface this with one comment. I'm a Marxist of the Rosa Luxemburg type persuasion, which kind of means I don't believe the government, period. Okay, particularly for a grand, dramatic issue like COVID coming and how we should be treated by COVID, okay, or what we should do about COVID. So the topic here, I think everybody in the room knows about Big Pharma. I don't think I need to say more about Big Pharma per se, but I need to say that, of course, the drama of the end of the Biden administration, beginning of the Trump administration was, of course, to get people vaccinated by either Pfizer, Moderna, or Johnson & Johnson vaccines, okay? And those all three are mRNA vaccines, okay? Now, the other thing on this title is early treatment. What is early treatment? Early treatment could be, okay, immunize yourself against COVID, but it can also be treatment by doctors of some other method than by vaccines, okay? So, and I'm going to be emphasizing the latter, as you'll see here. And one of the things, I'm not going to say, I'm going to move a little bit carefully here, but one of the alternatives is not the only alternative. One of the alternatives was a repurposed drug which had been used in Africa, particularly for river blindness, and it was given the Nobel Prize for that, okay? But what I'm going to get to is a repurposed drug that would have or have been an alternative, but basically Big Pharma smashed that possibility. So I'm going to be giving you evidence, much of which occurred even before any vaccine was available to anybody, okay? So in other words, in 2020 and the very first part of 2021, and then I'm going to have data going into into the end of 21. Now, the first thing I want to mention here is I have a copy of the paper here and all the citations and so forth and so on. You can pick up a copy of the paper here if you're interested. But just look at this government data, okay? For me, I'm not going to spend a lot of time on this, but for me, it says one thing. Of course, COVID carries risk, but the risk for children is so much less than for the elderly people that you really needed a long-term, careful study to ever give that vaccine to children. And I will say in the United States up until now, okay, even now they're pushing vaccines on children, and that other countries in the world are moving away from that, from vaccinating children. In any case, I can't go into, I have some references here, I can't go more into vaccinating children, except I would just say myself, I would never recommend, I would never support vaccinating children when you know so little about the long-term consequences of having these vaccines, these mRNA vaccines in your body for the children, okay? Now, the next thing I want to move to is what is the data? What does the data look like for, the data, okay? The data I'm showing you right now is data indicating what is the mortality of having, wait, check here. I missed one, I think. No, I didn't. Okay. The mortality of being unvaccinated versus being vaccinated, and you'll see that the ratio is very high, okay? That those who are vaccinated are much less likely to die than people who are unvaccinated by these same vaccines I've already talking about. For some of us, that might have been the end of the story, okay? But it's not the end of the story. It's not the end of the story, first of all, because there are, particularly for the United States, there is doctors who are convinced that hospitals, when they had a patient and the patient was unknown whether they had been vaccinated or not, that they would be listed as having been unvaccinated when they died, okay? So you don't really know whether the data are reliable. If there's a pressure on the hospitals to make sure that the people who die are listed as, or at least likely listed as being unvaccinated, okay? That would bias the data. Okay, now, I think that's more likely in the United States than it's in the UK. That might explain the difference between these numbers here. Now, next thing I want to move towards is RFK Jr. RFK Jr. wrote a very famous book. I mean, it's quite well read by lots of people, in which he said two things that are important for us. One of both of which I think are untrue. One of which was that he claimed that we should be looking at excess deaths, excess mortality. That means change the question about whether you're dying due to COVID. Simply look at the fact of regardless of why you died, what is the death rates? And for people who were vaccinated and people who were not vaccinated. And the numbers now change quite, I mean, they moved down considerably, but it still indicates that vaccinated people have a much lower, half a chance of dying as people who are unvaccinated, okay? Now, he had claimed that, in fact, the data were the opposite of that, but he was looking at data in a very early period, and the data I'm providing here are data which is much longer period of time. It goes up to the period up to for the weeks of the most serious portion of the COVID period. So basically, I dismissed that particular claim by RFK Jr. He made another claim that people who, that the death rate of people who are vaccinated, the total number of people who are dying who are vaccinated is higher than the number of people who are dying who are unvaccinated. The absolute numbers. What he forgets is that if, for example, the numbers I go through in my paper here, if 90% of the people are vaccinated, if 90% are vaccinated and 10% are not vaccinated, and the rate of dying is still lower by being vaccinated than being unvaccinated, but not dramatically lower, then yes, you will have more people dying who are vaccinated than people who are unvaccinated, okay? But he misses that. So that's my second criticism of RFK Jr., okay? Now let me move on, okay? These are the calculations that I mentioned. Now that becomes important because RFK makes those claims several times. Senator Ron Johnson makes those claims several times, that there's more people dying who are vaccinated than are unvaccinated. And I'm saying that that's a distortion of, because you have to look at the rate of people dying instead of the absolute numbers. Okay, so let me move beyond this. Now, you can't see on the screen here, but my paper is divided up into several sections. So the first section was trying to show sort of the benefits of the mRNA vaccines. Second section is, okay, several people who are serious people made calculations of people who had sudden deaths after getting a vaccine. It's a difficult calculation to make because the government does invite people to provide statements when somebody dies of a vaccine to the government. However, very like maybe 5% or 4% of the people who actually do die of a vaccine are actually reporting it to the government. It's not a requirement. It's an option to do it. Okay. So some people made some statistical calculations I cannot go through right now. It's too much. But basically the answer to that question is you can make a credible claim that a lot of people did die within a certain period of time after getting one of these mRNA vaccines. I mean, significant number of people. Now, there is a famous journal, medical journal, and they did a comprehensive study of many different countries. They're doing Brazil right at the top here. Okay. Oh, well, I'm already only at 5 minutes left. Okay. Well, anyway, they look at the people who are dying from. If you look at the rate of people who should be dying and the rate of people who are dying from COVID, and you look at then compare that to excess deaths, actually, at least for example, for Brazil, many more people were dying than would have been expected absent COVID than those who died from COVID, which gives you a lot of space for people dying for some other reason. Again, it's too complicated for me to go more into that, but I'm trying to whet your appetite a little bit for the problem. The last thing, the last major thing I want to go through is what is the alternative? The alternative is a drug called ivermectin, who you may have heard about. Ivermectin was a drug that was developed, as I said before, for curing river blindness and other diseases, particularly in Africa. It's widely known in Africa. Africa actually, generally speaking, had lower rates of COVID deaths and that was on a surprising side. People had expected an impoverished continent to have higher levels of COVID deaths. In fact, it was the other way around. And I think at least part of the reason for that was that they had widespread use of ivermectin. So anyway, what I have on the screen right now is that, switching to India, Uttar Pradesh is a state of India with 230 million people, which had very high levels of deaths, until the state government introduced medical kits, which would not cure you from COVID, but treat you for COVID so that you wouldn't die. And WHO praised this program. They did not, and the death rate really did fall down dramatically, but they did not tell you in their report that ivermectin was in those kits, okay? So again, it's a complicated topic. I can't go into it much more. I'm mentioning here the two persons who got the Nobel Prize for this ivermectin. Now, the last screen I have here is the propaganda aspect. Some of you may have seen this propaganda. It was extremely widespread by the FDA. What it says here is you are not a horse, you should not use ivermectin to treat or prevent COVID. Okay. That's extreme propaganda, because penicillin and aspirin both were not developed for what they're being used for now. They are repurposed drugs. Ivermectin is also a repurposed drug. It's got nothing to do with being a horse, okay? It's got nothing to do with whether you're a horse or a human. Ivermectin can be used for both. You can use penicillin for both humans and horses. This is just pure propaganda. Okay, I think that's I'm hoping just to introduce you to the topic. Thank you very much.